Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
What is up, everyone? Welcome back to another episode of Dental Student Vibes Podcast. I'm Seth. This is Matt. Matt, how are we today?
We are killing it today. We have our midterms coming up this week, and I think we're looking good.
Is it midterms?
Just about. I mean, one like a week of midterms. You know, when you think about it, I mean, we have 3 exams per class, so I would say like a tri-term.
Fall semester.
Yeah.
Let's see how many. We're in. What is this? Almost September now. So
almost.
Got like 4 more months, and then we're done, and then we got one more semester of clinic, and then we're on to our
externship.
Very exciting. So, Matt, I know you are hitting the struggle bus here with trying to get into the location that you want. So what's the deal with that?
I am working quietly but diligently to try to get into the externship location of my choosing. Hopefully, somebody will be gracious enough to switch. If not, maybe I can pay somebody to switch with me. And I mean, because going up north, anywhere where it snows, I'm a Florida boy, born and raised. I can't survive the winter. I can't. I'm not like Jon Snow. I couldn't make it through. Winter's coming, and I'm not surviving.
Well, that's one of the things that a lot of dental students face when they're hit their 4th year or so, is having to pay either for lots of different circumstances out of pocket for a lot of times it's for ADEX, having the patients come in, but now since we're not doing patient-based ADEX right now,
you can apply that money.
Yeah, it's beneficial for. But
another thing too is I can't really complain because it would be a year. Think about some of the people that have to go from Florida to like an up north school because that's where they got in. Like you look at my roommate. Her fiance just got into dental school. She's starting in Chicago next Monday. And, born and raised in Florida, and now she's in Chicago for 4 years. So, I mean, when you balance it and everything, it's like she's going to have a tough 4 years. It's going to be a rude awakening in December when the weather hits and it really starts snowing and everything in the windy city. It's going to be tough. So, my heart goes out to anyone that has to go from Florida, Texas, anywhere where it's, warmer into a colder climate.
Right. So back to exams right now. We got our management class
Yeah.
Yeah, that's on Tuesday.
That's such an enjoyable class, though.
It is.
Honestly, it's so important.
And they're doing an excellent job. I really
Yeah.
think that everything is very clearly delivered, and it's all encompassing.
Mm-hmm.
And it's a lot of information. That's a lot of info on all the slides. But that's definitely management, business management, incredible amount of information there. Importance when you're running your own practice.
It's a whole nother field, incorporated into the field you're going into. So there's obviously going to be a lot to know and a lot to remember. But, every successful dentist is a good businessman or businesswoman as well.
Right. I mean, look at all the people that we talked to, and that's really, like Mark Costas. He's probably one of the best of the best.
Oh yeah, and he's just as good a businessman as he is a clinician.
Right.
Everything he touches turns to gold. That's the way that you really want to, live your life and build your practice and everything. Surround yourself with a good team, and you can see like the people that come in and all the speakers that we have. They're all so just well informed and everything. You can tell that they're very good at their craft and what they do.
Right. So we got that coming up. Then we also have geriatrics, and what was our last class? Oh, we have I guess it's like second peds.
Peds 2.
Peds 2, I guess.
Peds 2.
Yeah. But then, how's clinic going for you?
Clinic is going well. We're in we're still in clinic, so we're blessed enough to be able to still work on patients and everything. It may not be to the amount of time that we'd like. We're in clinic for a quarter of the time that we would normally be in, but we can't complain because some schools are closed and everything, and there's other parts of the country really getting hit hard by this. We're at least lucky enough that we're open, so I can't complain about that. I've been cleaning a lot of teeth.
Have you? How do you like hand scaling?
It makes you appreciate the Cavitron. It really does. I mean, one cleaning could take, 10, 15 minutes when you have the Cavitron. But if you're hand scaling and everything, you're getting a real good wrist workout. Your carpal tunnel and everything, because you got to sit there and you got to grind on that thing constantly. And if you get like a calculus bridge, it's fun getting it off. But then afterwards, you're like, God, I just need a nap. You got to get a wrist brace or something. I can't complain though. It's dentistry. I love dentistry. Would I like to be cutting teeth and, like operative or, fixed pros? I would love to do that stuff. But for the time being, it'll just teach you how to, sharpen your skills.
Well, we're about to get started with that.
We are.
Have you treatment planned any crown and bridge, anything like that?
Not yet. But hold on. Why don't we get into your thing? You had surgery on Friday.
Oh yeah. So of course, I had a full mouth extraction.
Now, hold on. He walks in to school, and I'm sitting at the front desk because that Friday was my day to like temperature screen. So he walks in. He looks like he's going in for like open heart surgery. Like he's got the hat on and everything, like covering his hair, like he's ready. I'm like, oh my gosh. He's like,
well, the thing about the cap is it's got the buttons.
Yeah.
And then since we are basically wearing masks 24/7 now, I feel like Dumbo, like my ears are folding forwards almost.
And it starts like cutting off circulation. It hurts.
Yeah. So with the head cap, you can put the ear loops from your mask, put it over the buttons that are attached to your cap, and then there's like no pressure. It's great.
Yeah, I mean,
honestly.
My ears are like hurting. I'll be cleaning teeth and everything, and then my ears are like, I gotta get this thing off.
Yeah. So, but yeah, of course, the full mouth extraction didn't happen. Here's the reason. Here's the reason. I also have to do a biopsy. I forgot about that, and I had to finish the exam and stuff.
Mm-hmm.
And then when I got everything treatment planned, there's a couple other things I had to add in there, so I wouldn't have had enough time to do all the extractions, and the oral surgeon wasn't there either.
That's
so
tough. That'll do it.
And then it was also the alveoplasty, and there's a couple of things because this was in preparation for dentures.
Okay, so you had to smooth the ridge and everything. That's a lot of work.
Yeah,
that's going to be a huge learning experience.
That would have been real fun. Well, see, the thing is, it was an older patient, so we were going to go up to the midline. Oh, also, this is a full mouth extraction with only 6 teeth. And so it was going to be, up to the midline and then stop there because of the age, see how the patient does, and then
maybe continue with the others.
Right.
Gotcha. I can't wait to get into that. It's so cool, especially when you have like one-on-one with the oral surgeon. You get to just pick their brains and learn everything you can from them. Right. I can guarantee you're going to learn so much that day. I had a patient last week, and during COVID had a knee replacement, and now, if you're not aware, if you get a knee replacement or any sort of joint replacement, you have to pre-medicate with antibiotics beforehand.
No, that's not true.
That's not true until you talk to the orthopedic surgeon that did this guy's surgery, because our preceptor asked, he was like, hey, should we call first and see? I mean, just for protocol, we did. And luckily we did, because the orthopedic surgeon said that he wants pre-medication for us. I said, okay. Meanwhile, he never called and told us.
We'll tell everybody. So the I guess it's a controversy. It's not really a controversy, but the ADA says that pre-medication is not necessary for joint replacement. It's only necessary for heart valve replacement or something of the sort. But then, of course, any orthopedic surgeon is going to say, well, if I was getting the joint replacement, I would pre-medicate.
Yeah,
that's what the orthopedic surgeon said. So
and honestly, because he did the work, I figured we listen to him and everything.
Yeah,
shift of liability and everything. So we respected exactly.
Yeah.
So I ended up calling the office or whatever. I was on hold for a while, and then he finally gets on the phone and goes, "Oh, Dr. Havis." I'm like, "Whoa." Okay. I was like, all right, I can deal with that. And I'm all like, I'm all hyped up. He called me Dr. Havis. I'm ready to save some lives and stuff after hearing this. Like, it really got it lit a fire under me. Like, I was ready to move. Like, I don't know, it feels good when another professional is calling in. I mean, he's a, orthopedic surgeon. So he's been through the ringer. He's gone through the schooling. He's clearly made it. And for him to say that to me or whatever, or something so simple, but it just made me feel really good when he said that. Nobody's ever said that besides like a professor, or like my mom or something. So, so after hearing that from like another professional, it made me feel good.
Right. All right, guys. Well, that's a little update from us over here. D3 year fall. So we hope you all are doing well, staying safe. Thank you guys as always for the support. Thank you for the love. Be sure to check us out on Instagram at dental.student.vibes. We got more exciting stuff coming up soon. We hope you guys enjoyed all those interviews we recently did. We kind of did a lot of interviews in a short amount of time, so we had to take some time to focus on school. So we hope you guys are doing well and stay vibing.